Hi, I'm Dr. William Starziak, and in this video, I'm going to talk to you about cranial osteopathy. Cranial osteopathy was first discovered and developed in the 1930s by William Garner Sutherland, an osteopath at the time. Osteopathy, for those who don't know, deals with a few principles, but the one that is most key to understanding our conversation here today is the structure-function relationship. The relationship between the structure of something and the function that it serves. William Garner Sutherland, when he was still a student at osteopathic college, saw a disarticulated skull, a skull in which the bones were separated. Now, this is an important piece right now to understand, is that when someone dies, if the tissue is cleaned from the outside and inside of the skull, the bones can be relatively easily separated right along the suture lines. And I mention this because later it's going to be important to understand that there is motion between these bones. If there was no motion, like other joints in the body, these bones would fuse together and they would not be easy to separate after death. But you can even fill a skull with beans, soak it in water, and as the beans expand, they will disarticulate the skull. So when Sutherland was looking at this disarticulated skull, he was struck by the fact that the shape of some of the bones had a beveling. A beveling is like on the edge of a desk where it is facing, it's slanted down and it's facing up. So you can have beveling in different directions. So this would be an upward facing bevel if the rest of the object is going this way. If the rest of the object were going the other way, this could be a downward facing bevel. So the way that the bones fit together is they'll transition from being beveled one direction to being beveled the other direction. And Sutherland, when he saw this structure, he was struck by this idea that it implied motion. It implied articular motion, kind of like the gills of a fish. And he started investigating this. He did a bunch of experiments on himself using a baseball mitt and vice gloves, a baseball mitt and a vice grip, where he would restrict parts of his skull and witness what happened. And he set out to prove that the skull couldn't move, and he was unable to prove that. So he was convinced that the skull was changing shape over time. And he continued to do a lot of research and self-study on this, and settled upon this basic pattern of motion that's present in the skull. And he developed some treatments to address restrictions in this motion. Just like any other part of the body, with osteopathy, we find restriction of motion, and we apply treatments to restore normal motion. So he mapped this all out for the head. Still today, a lot of people will deny motion in the head, people who've never looked at the evidence. But we have MRI studies that demonstrate moment-to-moment change in the shape of the skull. So that right there is solid evidence that the skull is in fact moving. We have all of this evidence that shows the brain itself changes shape over time. One, from the blood flow being pumped in, it deforms from the blood flow, but just neural cells, brain neural cells, if you put them in a petri dish, they will pulse, they will contract and relax. There are a ton of studies out researching that. The measured change of distance in the skull is very low. And some people might say, okay, well, the skull moves, but there's no way you can feel it because that distance is so small. It's on the order of 40 to 70 micrometers, which is, between the width of a sheet of paper and a piece of hair. But if you put a piece of paper on a desk and you roll your finger over it, you can feel it. If you put a piece of hair down on a table and you roll your finger over it, you can feel it. In fact, you can put a couple pieces of paper over that piece of hair and you'll still be able to feel that piece of hair. Furthermore, we have a study that comes out of France that shows untrained hands can feel down to 50 micrometers of motion. That's 15 micrometers of motion with statistical significance. So through MRI, it's been demonstrated the skull moves. Anatomical studies of the skull at the end of life show that the cranial bones do not fuse together, that they're easily separated. And that separation, that easy separation, implies that there is motion throughout life. Otherwise, it would fuse. Like in diabetes, when people have nerve damage, because they don't have proprioception into their foot bones will fuse. And they're still mobile and they'll fuse. So it's clear that the skull would fuse if it wasn't moving. Additionally, if you do a microscopic dissection of the articulations in the skull, you'll find ligament in there. And the only function of ligament is to check motion. If there's no motion, the ligament will ossify and disappear. And then we've also shown that, the degree of motion that is occurring is palpable by human hands. And for a long time, it was unclear what is causing this motion. In osteopathy, it's referred to as the breath of life or the primary respiratory mechanism, and is really approached with a great reverence and awe at the mystery of what causes it. We have recently, in the past decade, discovered a correlation between this motion palpated in the skull and a physiologic phenomena called the Traub-Herring-Mayer oscillation, or the Traub-Herring-Mayer wave. Now, the Traub-Herring-Mayer wave is a sinusoidal pattern that has a period of 6 seconds, 10 cycles per minute. So it goes one direction about 3 seconds, and then it waves the other direction about 3 seconds. And so in total, it takes about 6 seconds, and then repeats that 10 times in a minute. There was a study done where osteopaths had their hands on a person's head. And at the same time, the Traub-Herring-Mayer wave was being followed using an infrared device attached to the earlobe that would measure relative dilation and constriction of blood vessels. Because the Traub-Herring-Mayer wave is an artifact, is evidence of oscillation in autonomic input. Autonomic input meaning the input of the two halves of the autonomic nervous system. The half that's associated with resting, digesting, healing, that is the parasympathetic half. And the half that's associated with urgency, often referred to as the fight or flight response, that is the sympathetic half. The body is passing back dominance back and forth from moment to moment to keep itself in a state of readiness to respond to whatever it needs to respond to. And this shows up as a change in heart rate from moment to moment, and also a change in heart rate variability, a change in blood pressure, which is because of a change in relative constriction or relaxation of arteries and veins, and also a change in muscle tension, an increase and a decrease. So with one phase, the parasympathetic relaxation phase, blood pressure decreases, heart rate variability increases, heart rate decreases, muscle tension decreases. And then in the next phase, the sympathetic fight or flight dominant part of the Traub-Herring-Mayer wave, blood pressure increases, heart rate increases, muscle tension increases, heart rate variability decreases. And this is a small sinusoidal wave around an average baseline. And what they found in this study was that the motion palpated by these osteopaths in the head was synchronous with the Traub-Herring-Mayer wave, which is implying that the motion we feel is connected with autonomic variability. Now, most osteopaths felt the motion at the beginning of each cycle of the Traub-Herring-Mayer wave. So when sympathetic input, fight or flight, the fight or flight half was dominant, they would say this is what we call flexion. And then when it came again, they would say this is what we call extension. So they were palpating the rhythm at 5 cycles per minute. But there was a subset of people that would call out flexion. This is one motion pattern of the skull. And now it's going into its reverse motion pattern, extension. And so they would end up counting out 10 repetitions of that cycle in a minute. And it's interesting because in my mind, those are the people who are feeling it correctly. The other group is thinking that they're feeling a different phenomena, but they're really feeling the same phenomena and they're calling it different things. Flexion and extension are kind of like inhalation and exhalation for the rib cage, but the equivalency in the skull. And it's a subtle enough motion that it would be forgivable for someone to think that flexion was extension. They could kind of, if their perception wasn't very finely tuned, they could just feel a motion, feel a strong motion and say, okay, this is one end, and then feel another strong motion and say, okay, this must be the other phenomena. But because this smaller group of people were matching up with 2 different phenomena, both increasing sympathetic tone and increasing parasympathetic tone, I would say they were the ones who were more sensitive and were really on the cranial rhythm correctly. Now, what does this all matter? The skull moves, it's connected with autonomic variability. How does it even play a role? Well, autonomic dysregulation plays a role in all of these different conditions. It controls vasodilation and vasoconstriction, which it comes into play in sinus problems, sinus congestion. It also comes into play in sinus headaches, in migraines. It comes into play in digestion because the autonomic system controls all of the digestive organs. In fact, it controls all of the organs everywhere. So if someone has slow gastric emptying time, that has an autonomic role. We have studies that show that osteopathic manipulation improves irritable bowel syndrome. It accelerates gastric emptying time when diabetics have delayed gastric emptying time. It has this whole suite of effects, and there's a lot more to be researched. We've had some recent research looking at a rat model where treatment of the cranium with this particular technique that accentuates the amplitude of cranial motion will actually help clear these proteins that are associated with Alzheimer's disease from rats. And it improves the rat's ability to learn, to lay down new memories, which is really amazing. So this could have implications for treating Alzheimer's disease in humans. So it's basically another area within the body to interact with the structure and can get results in these cases where nothing else is getting results. So what I would encourage someone listening to this video to consider is, are they dealing with some sort of problem that hasn't been able to be addressed by conventional medicine? And if so, do they have any head trauma in their history? Have they taken, a slip on the ice and hit the back of their head really hard? Or do they have some intense birth trauma? Do they have to be extracted by vacuum extraction from the labor canal? Were forceps used on them? Do you have a child who's suffering from recurrent ear infections? This is an excellent case for osteopathic manipulation. It can be used for adults, but it's excellent in children. Do you have a child who has a funny shaped head after they were born, plagiocephaly, that's not resolving? The caps that they use, the helmets, are one way to treat that, but they can actually restrict cranial motion. So even if you use the helmet, it's a good thing to make sure that they have normal cranial motion to help prevent problems down the line. And there's a bunch of research out that shows that osteopathic manipulation decreases the stress response so that people will respond better under the same stressful conditions. And there's, beginning to be more, there's mounting evidence for a lot of other conditions as well. So if you have curiosity about this, you want to learn more, of course, you can do Google searches on it. You can go to my website at www.drsiak.com and go under the What is Cranial Osteopathy tab, and I have linked some of these research articles that I discussed in this video. There's also a video from, I think it's the 70s or 80s, where there is Dr. Andrew Weil did a video with a pediatrician and an osteopath, Robert Fulford, and they discuss a case of this child that had chronic ear infections and was having to take antibiotics all the time until he started receiving this sort of treatment, and it totally resolved it. So those are some good resources there. If you want to schedule with me or if you have questions, you can call the office at 317-410-9978. And you can email me at info@drstarsiak.com. Please check out my other videos. There should be a link up here. And subscribe to my channel if you like what you heard. There should be a link over here. Thank you very much. Hope you have a good day.